Good afternoon, everyone. I'm Eileen Buckley, senior reporter for WBFO, and we are so glad you're joining us for our Facebook Live conversation. We are here today live at Crisis Services, a 24/7 lifeline for so many citizens. And this is another in a series of our mental health Facebook conversations that we're having. Support for WBFO's mental health initiative is provided by the Patrick P. Lee Foundation. We're working to raise awareness and help cut back on the stigma surrounding mental illness and mental health issues. And we decided to break out of our normal Facebook studio and come to the heart of the action here at Crisis Services to learn about this 24/7 assistance to our community and what it provides here and how they take calls to help our community. Our guests today are joining us is CEO Jessica Piero, Rachel Morrison, she is the director of the 24-hour crisis counseling program. Caitlin Pulowski is the Director of Advocate Department. And over here we have Jennifer Giambra, and Jennifer is actually a hotline counselor, correct? And she will be taking the calls and helping us out here today as well. So you'll be hearing about all of these different aspects that are provided here. We are here in a conference room broadcasting in order to keep to privacy rules, of course. But again, we will be hearing examples of calls that are in place and how citizens are directed for help. If you're in need of help, please don't hesitate to call 716-834-3131. And also, please offer your questions on Facebook. We will try to get to as many as possible to keep this conversation going this afternoon. So, Jessica, thank you for allowing us to invade your space today and here in your program and hear about all the services that you have. We really appreciate it.
And we appreciate it as well. Thank you for allowing us this opportunity to bring the community in and learn more about crisis services.
And what we want to tell our audience out there is Crisis Services handles 85,000 calls a year.
Yes, so we are one of the most comprehensive crisis centers in the Western New York area, and we manage various hotlines, but in total we average about 85,000 calls annually for people that are in crisis, looking for information referral, or just to receive some supportive counseling to manage a situation they might be dealing with.
And I was bullet pointing all the different services you have, from the 24-hour hotline, the rape and domestic assistance, suicide prevention, mental health trauma, drug addiction. You have your mobile outreach, and you train police officers as well. So you have so much that's going on within this facility.
Yeah, so those are our specialty areas: mental health, suicide prevention. We are the rape crisis center for the community. We also do domestic violence, family violence, elder abuse services as well. But we also do a lot of collaborative work in the community, addressing the emergency response for police, working with local hospitals to really make sure that people in crisis get immediate help and support to help in their healing and recovery from the experience or the trauma that they're dealing with.
To give a sense to our audience too, how many people are within your facility helping handle this 24 flow here and the volunteers that you have come in as well?
Yeah, so overall, with all of our departments, and I think that's an important piece that we'd like to highlight today, is that we have a programs of the organization. We have about over 90 full-time employees. We also use volunteers for both our hotline and our advocate department, which we'll touch on. And we also have some per diem staff. So we're a total of about over 100 individuals that are helping 24 hours a day to manage all of the services of crisis services.
Rachel, I want to transfer to you. Is there specifically any peak times for calls? Perhaps, suicides. Do things peak within the service center?
Yes, they do. Basically, a little bit after lunch hour starts, they kind of start to get a little high. Then they go down after 4 or 5 o'clock, when all of the agencies and all the businesses close and we're the ones that are still open. We see a peak from about the 4 to 7, 8 o'clock time. And those could be calls coming in, like Jessica said, regarding suicide support, any problems around domestic violence. Kind of starts up at that time and then slows down towards the evening and into the morning hours.
What happens when a suicide call comes in here, whether someone is suicidal or a family member calls in for someone else?
So if someone called in for themselves and they are experiencing thoughts of suicide, or if they have an active plan, our counselors are trained to make them as comfortable as possible, stay in that empathetic type of a tone, just to kind of let them know we're going to slow down, we're going to be able to help you and give them some comfort. Then we ask a few questions that are, we call lethality assessments, and that's just trying to see what is the means or what is their intent. Are they really just having thoughts of suicide, or are they, like I said, actively planning to end their lives? And so we ask questions around that, and then we bring our interventions in once we realize that we are at a state if someone is in that emergency state.
What perhaps are some of the misunderstandings that people have about crisis services and how you intake and help people?
We kind of feel that one of the misconceptions is that you call crisis services if you're in a serious crisis or if you are suicidal. But like Jessica mentioned, we're a supportive agency as well. So folks can call us if you're really having a tough day. We help around relationship issues. If you're seeking counseling, a variety of different reasons that folks call us, and we assist every day. So a misconception is that I have to call crisis services if I'm in a serious crisis or if I'm suicidal, and that's just not true.
Because I think there's a somewhat of a mystery of how, when a call comes in, where they're directed and how they're helped.
Yes, so that is kind of something that we've kind of mastered in our agency. Like Jessica mentioned, the different programs that we have within crisis services. If someone is calling for support, we figure out why they're calling. We may keep that call in the hotline and then provide them supportive counseling. But if it's elevated to a higher level, like someone really is thinking of taking their lives, then we involve our mobile outreach department, as Jessica mentioned. They're the program that kind of will take the next step from the hotline and really provide that intervention that is needed to help someone.
What about the calls regarding children and teenagers? What happens on this end?
So we do have a kids hotline as one of our many hotlines as well, and we have youth calling in from a variety of issues. We have parents calling in, professionals, teachers calling in, and we kind of just assess the situation again, see if someone is in an active situation at that moment. We will refer out to another agency for those specialized services for someone under the age of 18.
And what are the highest perhaps percentages? Do you get more calls from youth, adults? Is there any gauge of that?
We get most adults practically 25, 27 and on up. Not as many as the younger folks calling us, mostly the adults calling us. And we kind of make sure that we have the right linkage for them before they terminate the call.
Jessica, I want to come back to you to discuss a couple of more things here regarding your mobile outreach program. What does it provide?
So as Rachel mentioned, if somebody is calling into the hotline, the person themselves, a family member, a concerned friend, if somebody is threatening harm to themselves, so there are suicidal thoughts or concerns that there's harm to themselves or to others, that would then be taken over by our mobile outreach team. And those staff are mental health professionals that go out in the community, meet with people face-to-face to do a mental health evaluation to see if the person can remain safely in the community, and if they cannot, then we have the ability to take them to the hospital if that's the needed service and support to get them the proper care to keep them safe. So for example, if somebody is suicidal, the team will go out, they'll do an evaluation, do some safety planning, see if we can keep them with their protective supports and their family or friends. But if they can't and they're not going to be able to remain safe, we'll take them to the hospital for further evaluation and support. So those teams are going out 24/7 on the various types of calls. Last year, they had over 4,300 intakes for Erie County in managing all different types of situations where somebody just couldn't remain safe and we needed to intervene and provide support.
How many folks make up those teams?
Or crisis. Some might be just ongoing mental health concerns that somebody might need an intervention and support a little bit more than just a conversation on the hotline.
Caitlin, I want to bring you into the conversation here. We didn't forget about you. You direct the advocate department here at Crisis Services. What kind of advocacy are you providing with all of what we've discussed already?
Right. So the advocate department here at Crisis Services is our sexual and domestic violence unit. So we serve survivors and their loved ones who have experienced sexual assault, domestic violence, family violence, or elder abuse within the county.
And again, these 24-hour response teams are ready to go at a moment's notice for this.
We are. So right now, we have members of our team that are working both in the field as well as on our hotlines addressing these issues. And so at any point of the day, someone is on call for the advocate department. So within our county, if a survivor presents at a local emergency department, one of our team will also be dispatched to the hospital to talk that person through what resources and options are available to them as someone who has experienced sexual or domestic violence.
Those calls have to be so difficult and tremendous coming in here. What happens for a victim of either of those?
Right, so definitely we want anyone to know that if you've experienced sexual assault or domestic violence, or if somebody you care about has, that when we take a call on our hotline, so when you call 834-3131, you're going to listen to a live person who's going to believe your story, who's going to provide you options. So we'll talk through what going to court, like what medical options might be available, what support you might need in terms of getting linked to a therapist or a case manager who can help navigate these pretty complex systems and to provide support. So the first thing that folks should know is that when they call, they're going to be listened to, they're going to be believed, and we're going to help link you to whatever next support you might need.
Can you talk a little bit about what the SAFE program is here?
Absolutely. So SAFE stands for Sexual Assault Forensic Examiner Program, and we operate a community-based team that provides services to the Catholic and Kaleida hospitals. So we have a team of trained nurses who work with us, who will go out then to those hospital systems when a survivor who has experienced sexual assault presents, and if they are interested in receiving a forensic rape exam. And so that team of specially trained forensic examiners goes out and provides that service to survivors who are presenting in the hospital. And then they may also, at the survivor's choice, engage in that and engage in advocate program services where we will be able to assist someone through that process.
It's such a powerful and difficult time in someone's life when that happens. It must be kind of difficult on your end, too, to be able to handle all of those calls and those situations.
Right, so I feel very lucky to be able to work with this team of individuals who live the mission, and we're here because we want to serve people who have experienced this, and we believe in their pathway to healing. And so we make sure, and the funding and support of individuals is really critical to our department's operation. So is our volunteer program. So anyone who's interested in volunteering can also call our hotline and get more information about that. But it is tough. It is really difficult, and we often work with individuals or their loved ones on the worst day of their life. And so our goal is to really be that space that believes that person and helps them get to whatever their next best step is. Maybe it's helping navigate through something related to school and needing to get accommodations made through school, so we'll support them through that process. Maybe it's getting linked with some kind of court proceeding, and maybe it's getting some additional follow-up medical. So definitely I have a great team here across the entire agency that works to help folks who are having tough days.
A lot of moving parts within all of that. Have you added any new services now that we're into the new year here for advocacy?
We have. So we're really excited that the new year brings for us is some work in what's called PREA, so Prison Rape Elimination Act. So we're going to be working alongside both locally as well at a state level to provide services to incarcerated survivors who have experienced sexual assault. So this expands our goal and mission of serving folks who have experienced interpersonal violence, who've experienced sexual assault and domestic violence.
And what do they go through when they're in prison and they have to deal with that mentally?
Sure, so someone may have experienced something while incarcerated, or maybe has had a historical trauma, so maybe has experienced some kind of, unfortunately, child sex abuse, or is now an adult survivor of something they've experienced at some point. So we will provide hotline services and some case management services. So through calling the linked hotline from their facilities, a survivor who's incarcerated will be able to have access to similar services to the community, where we will talk through what are their presenting concerns, what are they worried about, and sometimes folks aren't sure what's available to them. So I would really encourage anyone to call into our hotline, even if they're unsure, just to explore what options might be available to me, or I'm worried about my loved one who is incarcerated, or I'm worried about my friend who just told me they've been sexually assaulted, and we'll be able to help sort out what happened and then what they might be able to be further linked to.
We are again live at Crisis Services here in Buffalo, and we are discussing all the many great programs. Please, if you can, send us your questions, and we'll try to get to them as we continue our broadcast here inside their facilities. You can probably hear in the background Jennifer Giambra here. She is on staff taking calls, and we've been told that Jennifer has been here for over 10 years as a hotline counselor, and she also trains their volunteers, recently promoted to a supervising counselor of the hotline. And when we can just break in here, we want to talk to her a little bit about some of the information. Again, not revealing privacy, but here to kind of give more of a concept and idea of what a hotline counselor does here. What, if you can, tell us some of the examples of calls that have come in?
Oh, we get a wide array of calls. We get anything from housing issues to anxiety attacks to suicide to addiction to domestic violence, sexual assault. We never really know when the line rings what's going to come in.
What can you tell me a little bit more about what some specific things have been called in that are happening out in the community?
Yeah, so a couple of calls are our mobile teams. So we had a mom calling looking for support for her adult son who was having some suicidal ideations, was locking themselves in a bathroom, was making a lot of statements, was non-compliant with their medication. Mom was kind of at her wit's end, didn't know what to do with this individual, and called looking for support, and we made a referral over to our mobile team. And that team can essentially go out and do a mental health assessment to determine whether or not that adult child needs to go to the hospital for further evaluation and or get linked to treatment if needed.
How do you, on your end, keep your cool, know what direction to send them in? How difficult is that? And especially when you're training others to do it as well.
I think it just comes with time. It comes with time, call after call, debriefing with your supervisors, your peers in the room, knowing agency protocols, and just building the confidence and being empathetic. You just have to kind of add all of that in to be able to keep calm and collective when you're on these calls.
We talk about encouraging family to call in. As you said, a mom called in for her child. Again, that is so important for everyone to look for signs of different things happening. What other calls beyond suicide do you get calls to help another person out?
Well, one of the examples I had earlier was an individual called and he had had an argument with his girlfriend. He was in recovery, a recent relapse, was drinking alcohol. Girlfriend got mad and decided to leave, wasn't returning his text messages or calls, and without her, he was feeling suicidal. So those type of situations where we have, some addiction component to that, and then the argument between him and his partner led him to feel hopeless that, if she leaves him, what's he going to do? So we have that. We have housing issues. We had with electricity and heat and all of that stuff, people are looking for rental or utility assistance. So those type of calls are what we see a high volume of.
A bit eye-opening, I think, to our community to realize how much different levels of categories and things that you all handle here. Is it difficult to train others, too, to do what you do every day?
No, I don't think it's difficult to train. It's actually, I think, pretty rewarding. People come into the volunteer program because they're committed to wanting to help. So as long as you have that and you have some level of empathy, you can get it in time.
Excellent. Jennifer, thank you for sharing all that. We do have a response coming in. Renee asks, if I'm worried about a friend who says they don't want to be here anymore, what should I expect when I call the hotline? And then what confidentiality if I don't want the friend to know, and that makes perfect sense, if they don't want the friend to know that they've called. Do you want to take that? Raisha?
Sure. So what you would do is you would call in and kind of just give the scenario, the situation, what's happening to somebody like Jennifer who would answer your call. She would give you, ask you some questions about the locality of your friend, and try to find out, again, how serious is this person with these threats of suicide? Are they just thinking about this? She would ask you, do they have a means for it? Did they tell you whether they're going to maybe take pills or something like that? Or are they just kind of thinking about it because they're going through a tough time and they just need somebody to talk to? In any event, the counselor would, again, ask you some questions, see if you are linked to counseling or see if your friend is linked to counseling, maybe give that suggestion, and then definitely suggest that your friend call in. The best impact would be made once the friend calls in so that we can really assess the lethality or the concerns of the friend. So if you could get the friend to call in, that would be best. It's a confidential call. Sometimes people are kind of afraid that we're linked to the system and other people would know that they're calling, and actually that wouldn't happen. The only time we would reach out for some assistance is if we did determine that that person was really at a high level of an emergency. Then we would have to step in and either get emergency services or our mobile outreach team.
But in a way, some shape or form, everything remains as confidential as possible here.
Yes, and if the friend wanted to remain confidential, you would be remained confidential. Again, we would want the client to call in. There could be an instance if your friend was, if you really was fearing for that person's life, that we would try to get the information from you and then have our mobile outreach team try to connect with that person. So in any way, if you call us, call 834-3131 to get this information, to see how we can get help to your friend, and then get help for you as far as support too. We do other trainings that help with families or people calling in to request, like how do they deal with a situation like this with their loved one. And if this is your friend, and then you may need support on how to continue to support your friend once their crisis is over with.
Again, we are live at Crisis Services, and we want to thank Renee for that question. It was a great question. If you have one, please send it now before we wrap up our broadcast here. Jessica, I wanted to turn back to you because one of the things in our community that we've been hearing a lot about lately is a situation when a police arrives at a mental health crisis or scene. And there's a lot of concern about their intervention, and I know we've covered quite a bit about the CIT training for officers. Oftentimes a person ends up being arrested and put into jail, holding center issues, but they need that mental evaluation, and I know there's kind of a bit of a struggle with this topic in our community.
Yeah, so law enforcement, tends to be sometimes the first contact in a mental health crisis or a mental health call. A few years ago, Crisis Services, in partnership with the county, looked at ways to enhance training for law enforcement. They would get a set number of hours in the recruit academy, and then they'd be on the streets doing their work. There really wasn't that advanced training to understand how to deal with a mental health call versus a criminal call. A mental health call is not a criminal call, and it's a different approach. You really have to take your time, you have to de-escalate the situation and really kind of understand where that person is coming from to help intervene and deal with the particular situation in front of law enforcement. So we have implemented what's referred to as the CIT program, which is Crisis Intervention Team Training. It's a best practice for law enforcement. It's actually an international model, and so officers from the various departments in the county get trained in, it's a 40-hour component. It's 32 hours of classroom training, and then they actually do 8 hours of shadowing here at Crisis Services with our mobile team to understand kind of our side of the work as well. So we've trained in the couple years we've been running the CIT program over about 400 officers in the county. We've also last year expanded that training to 911 dispatch to make sure that kind of the language that's used from the initial call and then the handoff to the police is clear, especially around mental health concerns. We also partner with the departments that have CIT trained officers to do follow-up case management. So it's really kind of become a very robust program for the county, and we continue to do trainings annually to train more officers in the CIT model, and it really helps them not only in mental health calls, but just calls in general, I think. It helps them to kind of understand how to de-escalate something to maybe prevent ultimately any hands-on need for restraint. It also has proven to shown a reduction of harm to officers as well, because they're just trained differently in how to respond and de-escalate the situation.
I don't know if you can answer this or any one of you. What perhaps do you learn when you meet with the officers and begin the training? What perhaps are they doing wrong that starts them out?
Well, I think, we have to remember law enforcement, when somebody chooses to become a police officer, they go through a very extensive recruit academy, trained on all different types of things that they need to know about becoming a police officer, what the penal codes are to deal with different types of crimes and things like that. And there is a component about mental health that they're trained on, but it's just more general awareness around mental health and the resources in the community. The CIT training actually puts them in the seat of somebody with a mental illness. We have peer specialists that come in that have lived experience with mental health or addiction, talking about their own experiences with police so that they can understand and empathize with where that person's coming from. We also just talk about ways to approach a conversation with somebody who is in a mental health crisis versus maybe how they might respond to a kind of restoring order if there's a criminal matter. They're very different types of cases and responses. So it's just really enhancing their training and really helping them to kind of change their mindset when that mental health call comes in.
But I think that sticking point here in the community is that so-called mental health evaluation. Where are they taken? Are they taken right to ECMC or not necessarily? If they're not arrested, what happens in that process? And I think that's where there's that community outcry.
That's a great point. So if police are responding to a mental health call, they'll do an initial evaluation of the situation. They may pull us in at that point. Then our mobile team comes out and as a partnership with law enforcement really evaluate what's going on and then seeing if we can take over helping to manage that situation with that person. Now, if somebody is in a high level of crisis, they can't keep themselves safe, we deem that they fit the criteria under the mental hygiene law, we can involuntarily, both crisis services, mobile outreach, as well as law enforcement can involuntarily take people to the hospital for further psychiatric evaluation. That would be locally ECMC is the main hospital that mostly people would be taken to.
Another question, it is from Renee again, and she asks, does Crisis Service offer workshops, for instance, for youth or parent groups? And that's a wonderful question. Maybe advocacy can help out with that question, and that's a great component.
It's a great question. And so, yes, we offer direct services to survivors and their families, but we also have a team of trainers. And, Jennifer was talking a little bit about training volunteers and doing trainings, and we do. So we have teams of educators throughout the agency that can go out and provide workshops, trainings, specialized trainings related to potentially suicide prevention. My team can go out and provide skills and workshops related to healthy relationships, how to identify sexual and domestic violence if you're concerned. So we regularly train youth, we regularly train families, and we certainly work with a variety of professionals and colleagues throughout the county to provide professional development and hands-on workshops to really understand the lens of either crisis, mental health, and sexual assault and domestic violence.
Again, we're live at Crisis Services. If you have any questions, please send them to over here to Crisis Services. I know we've talked a lot about handling the intake of calls of suicide, but when we look at kind of the national numbers of 30% increase, am I correct?
Yes.
It's very alarming. What are, the age groups, the demographics that's happening, and if each of you would like to offer something on this, some perspective. And also, another question to that is, when we had last year the Kate Spade, the Anthony Bourdain, what happened here?
Yeah, it's really an important conversation. So nationally, we are seeing continued increases of suicide rates, and we then also see that at a local level. One of the things we also manage here at Crisis Services is the Suicide Prevention Coalition, which is a group of stakeholders working to address suicide prevention, intervention, as well as response for those that are impacted by suicide. But what we have seen as we monitor our own story, our own data locally of the number of deaths by suicide, we continue to kind of trend the national average. But what we're seeing is that the majority of deaths by suicide are between the ages of 40 to 65, and they tend to be middle-aged men. So we are doing some initiatives to do some targeted outreach around men's mental health to help in reducing those high numbers of suicide in that age group. The second then age group after that is the 20 to like 39, 40, and that's a high, the next highest rate. But what we're hoping with the various conversations, not only as Crisis Services, but many partners in the community to help reduce stigma around mental health, is to make it more comfortable to reach out, to call our hotline and remain anonymous if needed to get the support that they need, so that we can reduce the number of suicides in our own community. We have seen from 2017 to 2018, our calls to the hotline specific to suicide increase about 20%, and that's a great thing. We want people calling in and getting the help that they need, and we hope that then we'll see the numbers of death reduced because people are getting the help that they need before the suicide even becomes an option for them.
Absolutely. Ladies, did you want to weigh in on any of that from your perspective in the front lines of what you do?
Yeah, sure. I was thinking, one thing I'd want to add to is we do have the addiction and open access hotline is one of our main hotlines to the agency. And I want folks to understand that if you have addiction issues, if someone in your family has addictions issues, they go hand in hand with suicide sometimes. You do have that helpless or that hopeless type of feeling that you can still call Crisis Services, and we will give you the same care. We do the same assessments. We just try to make sure that we can keep you safe or that we can get someone out to help keep you safe. So the main thing is just to remember, please give us a call if you or someone you love, if you're watching something and someone reports it to you, that you call. You have a number that you can call just to get that information, just to see, okay, what's the next step? Because sometimes we just don't know what to do if you're never in that situation before. So it's very important that you can understand to give us a call. We will give you the information that you need. If it's not here, we will find it for you.
And we don't want to forget about the major opioid and drug crisis that's happening in our community and across the nation. What kind of pressure has that put on this facility and the center to have to deal with that as well?
Well, not really too much pressure. We did join the opioid task force a couple years ago to try to be a part of the solution and a part of the help. So we joined in with them to create the Addictions and Open Access Hotline. And it's kind of evolved over the last couple years. We've been able to get more resources out to different counties. If you're in Chautauqua, Cattaraugus, Allegheny, Niagara County, you can call as well. And we have linked with another collateral partnership with us to reach out and get information to you, to get resources for you. So we've kind of all come together to join in this fight. So we were prepared, we are prepared, and we have a whole hotline here dedicated to help you.
Caitlin, did you want to respond to those questions on the suicide that we talked about?
Thank you. I think I would add the piece too that if someone has experienced sexual or domestic violence, you could also be experiencing suicidal ideation. You could be concerned. And so I think that recognizing that if we know someone that we love and care about has experienced sexual or domestic violence, that they may also have concerns around suicide. And so that if you have questions or if you need more information, please don't hesitate to call, and we will do exactly like what Rachelle was talking about, is to help assess and provide linkage and support right there on the phone.
Absolutely. We want to let you know that since we've been here, 4 calls came in between 1 and 1:20 this afternoon, and 1 had a suicidal ideation. Want to come back to you over here on the hotline as we talked about that 30% increase and the different demographics from the front lines again. Your thoughts on that and what's been happening?
Well, I think that it just shows that suicide is also an epidemic, just like any other major health issue, and that, you know, there are resources available if or when you're struggling, and, you know, there's no shame in seeking help. And so we just need to reduce that stigma so people reach out.
We have Renee is again asking another question that she works with youth, and she's concerned about being sure, trying to read this, that they're not doing things in the wrong way, I believe, when it comes to youth in a crisis. And that's obviously a very important situation and question. And I wanted to kind of bring in the fact that the schools now, with their mental health curriculum in place, and we've done so much on that reporting, that they're opening up these conversations and they're having different forums and events for parents talking about suicide and not letting it be this stigma around that.
Absolutely, and we definitely have seen that as well around schools being trained more in responding to suicide. Schools also offering opportunities for parents to come together and learn about this, because it's can be a very scary conversation to begin with. So knowing that there's support and resources available. But I think also, I guess I would like to make sure people understand that they can call us for support and consultation. So if Renee has a situation and she's just not sure, is this the right thing to do? Give our hotline counselor a call, walk us through what's going on. We can see if there's any other ideas or resources we can direct you to. We want people to feel confident in the help that they're providing to their loved ones or to other people in the community, and we're there to support you in doing that.
Well, we're going to wrap it up now, but we want to thank everyone for joining us here at Crisis Services. This has been a great conversation. I hope that we offered the community help and a place to go to and a place to turn to realize all the great work that is happening here. Jessica, Caitlin, Rachelle, and Jennifer, thank you so much for joining us, sharing your great work and information with the public. We want to thank our Facebook Live audience. I'm Eileen Buckley, senior reporter at WBFO. We'll be continuing more conversations about mental health in the future. This, of course, is supported by the Patrick Lee Foundation. Again, thank you all for joining us this afternoon. We really appreciate it.